I remember how you told me that life may not be easy, and everything that I need, you've already given me.
Hey, I'm here with Dr. Sands, who's one of our wonderful Unite sponsors. Thank you so much for being here.
My pleasure.
And tell us what kind of doctor you are and why you decided to get into this field.
So I'm a board certified plastic surgeon. My training was in general surgery and then a fellowship in plastics and reconstructive surgery. And so, how Unite relates to our practice is obviously some of our patient population are breast cancer reconstruction patients. And there is such an important role that the Unite Foundation and group and ladies play in the recovery for our patients.
And was there something that led you to want to be a doctor when you were younger, or?
There was, yeah. So I was an engineer, chemical engineer before.
Oh, wow.
I was actually graduated in chemical engineering and working for Exxon at the time, and there was something that was nagging at me all the time, in the engineering field where I was always by myself, not really doing things, with my hands, and I wasn't, interacting with people on a very personal level, and that was something that bothered me. And something that I came back to when I was younger. In college, I did youth ministry work at a local non-denominational church, and one day we had a young kid who was a teenager that came in off the streets and one of our events that evening, and I started talking to him, and he started coming every week. And then later, a couple months after that, he pulled me aside and he said, that night that you kind of took me in and started talking to me, he said, that night I was in a really bad place, and I was at a point where I really was going to go home and kill myself because of the things that have been going on in my life. But by talking to you and then getting involved with this, I just knew that there was more that I needed to do. And so he said, I just wanted to thank you. And it was at that time where I felt like, oh my gosh, that feeling of, having, some positive impact on somebody's life on a very personal level was just something that you can't, it's very hard to replicate that feeling and that sense of satisfaction. And so that's when I made that decision. I said, I think medicine is that profession or that avenue that really kind of fulfills all of those desires that I have long term. And I think it's really important for people to be successful, to be passionate about what they do every day if you're going to do it for the rest of your life.
Well, your work with ministry probably makes you the perfect doctor to deal with patients who have cancer. As you know, a lot of patients who have cancer feel a tremendous amount of anxiousness, and going through all these surgeries and reconstruction and embracing your new body is very difficult. So how do you help ease patients' fears and their feelings of being anxious?
I think it's really just getting down on a personal level, taking time with each individual person, listening to them, recognizing their concerns, validating their concerns, their fears, and just being there for them. It's almost like, it is a relationship. And
Absolutely.
So those things that are important in every other relationship in our life are just as important in this relationship. There's just certain things that, as a physician and a patient where, we are not able to take over, that I think Unite does take over in, and that's so valuable for those patients after they've had their surgeries or, they're getting still through treatment.
So when you you've been a Unite sponsor for about 3 years now, and we've seen you at the shows. What's it like for you to see not only maybe your patients, but these other women who are maybe in the middle of their battle, or they've conquered cancer, or they might be newly diagnosed? What's that like to see them up on stage?
Well, as physicians, we usually see people in a very vulnerable state.
Right.
They're broken down, they're humbled, they're crying, they're emotional. And so that's the side that we typically see. And it's, when you're involved with Unite and you're able to see a completely different emotional state in these patients, that they're going to be okay. And that's very satisfying, because I think that's the aspect that, we don't commonly see, like in an office setting, in a medical office or in a hospital or in an operating room. We see people that are vulnerable and scared and nervous. We don't really see their true colors. And then, on those nights where we have, Runways, shows, and all of the things that Unite does for those patients. They're able to open up, and we see their true colors. We see the excitement and smile come back on their face.
Right, they emerge.
They do.
They look a lot different when they're on the stage. So you have seen a lot of people go through cancer and various other things. Do you think you would recommend Unite to most of your patients?
Without a doubt, yeah. I think the unique aspect of Unite is the fact that, as physicians, as I said, we concentrate on very important things with regards to the science and the medical side of their patients' recovery. But what Unite offers is not only just an outlet, but relationships with other people, with other patients who have been through it, who are going through it. And that's not something as a medical provider in a community we can really provide. It is the missing link that these patients really need to really optimize their recovery process and going through this to get to where they need to be on the other side. And that is just something that is invaluable to our patients.
When patients are going through these breast cancer reconstruction surgeries, your life, your body is changing. Have you seen, since your career began, have you seen advancements that you think have been real game changers for the industry?
Well, there's constant. So plastic surgery and surgery and medicine in general is constantly evolving, and plastic surgery is one I think that we've seen in the last 15 years, 20 years even. Large advances in the area of breast reconstruction. We continually push the envelope. It's no longer just acceptable to just put something there as a replacement for the loss of breast tissue or breast mound. We are now, the goal is to push the envelope to get patients back to where they were before, or even better than where they were before. And sometimes that takes multiple surgeries, but we know now that that's our ultimate goal, and we want patients to understand that as well.
This might be a tricky question, but if you could sum up Unite in one word, what would it be?
Sisterhood.
That's wonderful. That's a good one. Nobody's ever said that yet. That's a good one.
When I look at these ladies and I see the relationships, I think I've heard that from some of our patients, that word of sisterhood, but you see them together and like how close they are at all the events, and it truly is a sisterhood, and it's relationships and things that are so untangible but that are so important that they get from each other being involved.
One of the things I love about Unite is getting to know the doctors and our sponsors personally. So tell us a little bit about yourself. You were born in Louisiana. Where were you born and raised?
I was born in Baton Rouge. As I said, I went to LSU for engineering, and then moved to Houston, Texas to work for Exxon, and then came back to New Orleans to go to medical school, and that's where I met with my wife, who's a physician as well.
Oh, wow.
And then we moved back to Houston to train. And then once we finished our training, I came back here for plastics and reconstructive surgery at Tulane. And then our family is in this proximity. She's from New Orleans area. My parents are from the Baton Rouge area, and we had children by that time. So we now have 3 boys. Life, just snowballs, and so now we have 3 boys that consume our lives outside of the office with sports and school and everything else. So
right.
We're busy with it.
So you keep coming back to New Orleans. I tell people, I'm not from New Orleans, but I've lived here for a long time. I tell people Louisiana is like mold. It grows on you and it's hard to get rid of. You keep coming back.
Yeah.
So what's your favorite thing about Louisiana?
I think it's the people. I mean, just the fact that, you can go anywhere and you feel so comfortable with people, and people are so inviting and just, engaging. And so, you go to other cities sometimes and there's this feeling of just coldness, being cold. People don't want to talk to you and interact with you. And you can go anywhere in this state, city, and people, you never know, they just walk up to you and you offer you food and a drink or anything else.
And then they're your best friend.
Yeah, right. So that's just the culture.
Right. Absolutely. Yeah. I agree. So are you going to be there on October 1st for the Ribbons Rock, the Runway?
Yep. We're going to be there, and our staff will be there as well. And we actually, one of our staff members, our nurse, is involved with it very intimately as well, and she's going to be an ambassador as well. So,
that's wonderful. Yeah. I love that. Well, we really appreciate your sponsorship for all of these years and all of your support, and we love seeing you at all the events. So thank you to Dr. Sands for being such a wonderful sponsor.
Thank you.
You've walked me through fire. the smoke